So let's continue talking about this friend of ours that she was originally your patient, but I love to watch her in this journey she is, because I'm sure she told you when she was 49, didn't recognize herself, all the depression, all the loathing, what she was becoming, couldn't even recognize how she was feeling. And then when she was trying to celebrate turning 50, she went on a girls' trip where the activity was trapeze, and she discovered that she couldn't hold on or she couldn't do the tricks. And it was a real wake up, like, oh my God, if I don't get in front of this, I don't want to live 40 more years like this. So she visited you. She got all set up with her toolbox, and then she had knee pain. So she visited me, and I didn't know she was coming. So I walk into the room, and I always say to patients, hi, I'm Dr. Wright. How can I help you today? And she was just a fountain. I've seen Mary Claire. She did this and this and this, and now my knee hurts, and blah, blah, blah. And then since that time, I think both of us have taken a real interest in her journey, because she is becoming the woman she always was. Right. And getting her life back. And for me, that's enough, right? One woman at a time.
One woman at a time.
Getting their lives back. Because I always say, women make 80% of the healthcare decisions in this country for ourselves and everybody they touch. And then if we touch one woman at a time, which even with 3 million women that you have, you are touching one heart and soul at a time. We're going to change this for our daughters.
That's the goal.
That is it. You have daughters, I have daughters, and I was lucky. My parents said, Vonda, you can be anything you want to be. And so, yeah, I'm a surgeon, right? I'm anything I want to be, but it's not equal. And so part of my life's work is paving a way for them to be paid equally, to have the opportunities. And I'm sure you feel that way for your daughters, especially your oldest in med school. But now I don't want them to have to hit a wall in midlife, because women are in their prime. Right now, I feel like, I don't know how you feel, I think you feel like this is the prime time.
This is the best.
This is the prime time.
I may have had better hair in my 30s, but I've never been more successful. I've never reached so many people. I've never touched so many lives. I'm so proud of the work I did in the trenches as a, excellent OBGYN who did not have great menopause training. I was not a great menopause provider. I am now. Yes. But now where I'm at, and thank God I think I had horrible menopause symptoms, because if I would have breezed through it and been one of the 15 percenters who just kind of were like, oh, my period stopped, I'm fine, it wouldn't have taken me on this journey. And it was really the social media following that opened my mind to all of the symptoms, because we weren't taught. It was the genital urinary, maybe some brain fog, you won't sleep, but like not the musculoskeletal. Right. Not, not the mental health. Women were depressed because they're just women. And they, that's bullshit. Yeah. And not that hormones can have any effect on that. And now, if you look at each individual specialty, there is data from the mental health professionals, from the cardiologists were the ones leading the way, saying, hey, wait a minute. The summary says clearly, you start hormone therapy in this window of opportunity in those first 10 years, you will benefit, your cardiovascular system will benefit, and you will live longer without heart disease.
Absolutely.
Than you would without it.
And it's that message, despite the fact that the cardio doctors came out with the paper first. I was in Atlanta. It sounds strange, but I was the president of the American Heart Association in Atlanta. And I did that because all my family dies of heart disease. And I wanted to lead the pathway there. But nobody talked about menopause and the role of estrogen and the inflammation and what it does to our vessels. So now that they've written that paper, I think one of the spectrum of beautiful things that's coming out of your movement here is that the subspecialties are like, it's
our movement.
It's our movement. We're going back in our literature.
The metaverse is getting bigger.
It is. Well, we're going back in our literature, and the fact that women have more arthritis after 50 than men do, and what's happening to our cartilage matrix is 75-year-old data. And I was in orthopedic training for, 11 years of my life, never once, right? And so when women hit a brick wall with their doctors, or come with what the lane that I've chosen within menopause, which is the 80% or so of women who have musculoskeletal syndrome of menopause.
So
I
for
am,
my followers,
yes,
Dr. Wright is an orthopedic surgeon
I am.
and a
Yeah.
woman.
Yes. How
And a
about that?
menopausal woman.
Yes,
and
that's right.
so this is her life's, well, you've been a researcher forever.
I have, and I take that aging research and now view it through the lens of menopause, meaning that you can have hot flashes, you can have brain fog, night sweats, but if we don't pay attention to our bones, our muscles, the growth of adipose tissue, what our cartilage is doing, and we just let that happen, that is devastating and deadly.
What do you see in your clinic? I mean, you see the worst of it, right?
I see the best and the worst. I see midlife women coming in bewildered about why they did nothing and their shoulder can't move and it's so painful. Or maybe they know they hit it on the bedroom door on the way out, but why in the world would that cause their arm to freeze up like that? And then they'll go to traditional physicians and be told it's just a part of aging, just live with it. And to that, I think that is a cop-out for any doctor just to say, oh, well, it's what happens, is a cop-out. Dig a little deeper. If you don't know yourself, then surround yourself with the resources to say, okay, I don't know this, but you need to watch or go talk to this person, instead of just saying, A, it doesn't exist, or B, it's just copping out to aging, right? I mean, the example I use, okay, I have to say, I do love men. I love my husband and I love my colleagues.
And your son,
But I'm
yeah.
sorry, and my sons, but I'm sorry, ED then is a natural part of aging. Let's just let you ride with that. But no, there's 29 formulations for that problem, and we can't even get the black labels, the red labels off of
From
hormones.
the FDA, yeah.
Yeah,
we
that our
can't get
body
the FDA
makes.
to put correct warnings
On the-
on the boxes. You
Right.
know, they basically took data from 50 years ago from high-dose birth control pills
And slapped it
slapped it
across
on every single thing that
Yeah.
contains estrogen. And
It's
it's
true.
ridiculous.
So even as an orthopedic surgeon, somebody coming in with shoulder pain or bursitis in their hip or end-stage arthritis in a youngish woman, the conversation doesn't stop with, well, what can I do surgically to help you? In fact, it never starts with that. It always starts with, this is your age, you are in perimenopause, and then we talk about all the things.
And are they shocked?
They are crying because somebody's listening to them. Because if you go to one of my male colleagues, unless they're incredibly enlightened,
And you say that because what's the percentage of men?
there are 94% orthopedic men in the country. And so women, when I was training, there were 3% women. Now there are 6% women. We've doubled, but still 6%. So bless those guys' hearts. We're not trained to know about this. They're not going to know about it. They will not have experienced it. They were born, sadly, without a uterus and ovaries. Right.
Poor things.
Poor things. So they come from a tough place. They can't reproduce, right? We can make babies. So that's the thing. But the thing is, they don't know. And so many times when a woman comes to them, they're just like, okay, so your body hurts. There's no surgery involved. And I'm not hating on my own field. I'm just saying we can do better. So that's why when I recognize that and I see that in women, that's why they cry. Not because I've said anything tragic to them, but because they feel heard. And then we go through, well, this is what we're going to do about it. And we talk about anti-inflammatory diets. We talk about getting strong. We talk about HT. I'm an orthopedic surgeon. And for women with a simple history, I prescribe it for them.
Hormone therapy?
Yes, hormone therapy. And so I think what I do is what all the subspecialties need to do is to treat women as a whole person.
Right.
Because it is also a cop-out to say, oh, that's OB. Only they are going to pay attention.
So I think the data is that a woman will have 3 visits with 3 different physicians before her menopause is diagnosed, because the organ system affects so many different parts. And doctors love a checklist. You know, we look for horses, not zebras. And like, no one realizes the menopause horse is everywhere in your body. So you might present to the dermatologist with this new onset of dry, itchy skin, or the neurologist with little, feeling tingling sensations or formication, feeling like ants are crawling on your skin, or ENT because your ears are so itchy you can't stand it, you're not sleeping at night, or cardiologist for palpitations. And menopause is causing all of this.
Right, and unless you see the whole elephant, if you want, that analogy, if you only see the knee of the elephant, that's all you think is in the room versus the whole picture of a person. So part of it is calling on doctors to be whole person clinicians. Part of it is being able to self-educate. If we didn't get it in school, which none of us didn't, but we are lifelong learners. We're going to self-educate like you just did. And in my field, knowing that there are 6 or 7 musculoskeletal components that are most common. There's probably more. The arthralgias, the total body pain, the inflammation, the frozen shoulder, the degradation of cartilage, the frank loss of bone density, which is what causes frailty in this country.
Right.
It is not uncommon for a woman in her 70s and 80s to fall from a standing position and break her hip. Doing her dishes, like nothing. Just, so did the bone break and she fell, or did she slip and then fall, right? We don't know, but what it means is that without paying attention to bone and muscle, women are becoming frail. And you're right, when you speak about this, women live longer. But if we don't step in front of it, we become frail, right?
So talk about percentages. What % of women will have an osteoporotic fracture before they die of any type?
About 50% will have a fracture. And fracture is the #1 risk factor for fracture. So there's a lady here on the boat who recently broke her ankle. She recently broke her wrist. She's in her mid-60s debating what to do about her bone health. And I was quite frank with her. I'm a surgeon. I'm very transparent. I said, you've had 2 fractures. It is a predictor of your future fracture. You need a DEXA scan, you need to do all the things, and you need to consider HT so that you don't continue to degrade your bones. Fracture is, when you break your hip, 50% of the time, you do not return to pre-fall function, meaning you can't live in the house you raise your children in. 30% of the time, you can die from comorbidities, right? We lose, laying in a hospital bed, about 9% of our muscle mass in 1 week. You just become more frail and more frail.
Right. That was fascinating, that data to me of we are on this steady state of muscle and bone loss, but when we get to the illness and injury portions, that happen to all of us. We have massive loss.
We have no residual. We have no physical resilience to fall back on if we haven't paid attention. So, in a recent interview, I said something about if we do not get in front of our bones, muscle, and cartilage, we will end up frail old women. And that really meant something to a lot of people because we all have aunts and grandmas and friends who we've seen gone from vibrancy to frailty. But I'm telling you, Mary Claire, not on my watch. Right? Not on your watch.
No, not
right?
on my
not
watch.
on my watch.
I'm like, no. I mean,
listen.
And we can't physically see all the women in the world, but we can talk on social media and people are paying attention. And we're trying to give them actionable items that they can, or ways to talk to physicians, things to ask for, easy things that they could do. Talk about what your osteoporosis prevention toolkit would look like.
That's right. So A is early recognition of risks. Is your mother shrinking? Right? She was 5'4", now she's 4'11". Well, that is her spine collapsing from osteoporosis. Did you smoke? Have you been on prednisone or steroids in your lifetime? Are you fair and little? Did you have periods as a young woman, or were you too thin? Right? Because that whole system shuts down when we have lack of energy, a metabolic energy. So, and for instance, I was an athlete my whole life. I could go 6 months without a period, during which I was probably not laying down enough bone.
Right.
So know your risk. Let's get a DEXA scan. Just because insurance will pay for it at 65 does not mean that is the time you need a DEXA scan.
Yeah.
If you are at risk, we're going to get a baseline. And maybe we have to pay the $99 out of our pocket, but it is worth knowing.
It's worth the investment.
Me too. That's number 1. Number 2 is let's be strong as a bull. We talk all the time about wearing weighted vests, lifting heavy, not just being so afraid that we're going to bulk up. Good for you if you bulk up. It took you 6 years to bulk up because we don't build muscle that fast.
Right. It's really hard.
Bodybuilders take a decade to bulk up. That's not going to happen just with the resistance training to stay strong. We need to defocus on high intensity interval training every single day, because what happens is you get hurt, you end up in my Monday morning weekend warrior clinic, and you're just shut down for a while. And then things like eating enough protein in our diet, 1 gram per ideal pound, magnesium, calcium plus minus, and I know there's a recent paper that says maybe magnesium isn't as good for us as we thought it was. I don't care, take it anyway. I'm going to hedge my bets on the side of over preparing for that. And then there are a whole series of different kind of bone preserving, bone building drugs that can be evaluated. And, for that, I partner with an endocrinologist so that my women are treated with the correct drug for their particular need, if they decide to do it at all. But what it isn't is one thing.
Right.
It's a lifestyle.
It's a lifestyle.
It is a lifestyle. What do you think of this silly analogy? I thought of this the other day, and I'm not trying to be all woo-woo or silly about this, but
You're still a surgeon.
I'm still, I was thinking through, well, what do we expect? So, okay, bear with me.
I got it.
When a monarch caterpillar is crawling along the ground, eating leaves, and decides then it's time to become an adult, and builds this gorgeous green chrysalis around itself, that caterpillar totally dissolves, loses its body structure, and develops into something completely different because of the hormonal forces in its life. And then it emerges as this glorious being that is strong enough to fly from South America to North America. And I think that must hurt in the chrysalis, because old things have passed away and new things are coming. Right. And so I think maybe the transition that we go to from fertility to the rest of our lives, I don't want it ever viewed as a tragedy. Right. I want it viewed as, what an amazing opportunity to live a second adulthood.
I love it.
Yeah, we get to live again.
I love it. I love that, because I'm so focused when I'm spreading the message. There's a lot of anger that I have, that the system is failing the menopausal woman.
And that's the truth.
There's a lot of snark, but but this is the best time of my life, and I don't want to go back to that. I don't want to have a baby.
No, I'm done.
I'm done. And this is, I'm properly supporting the last third of my life. Yeah. And I want to take everybody with me, and I want to show my kids.
That's right. So that it's not even an issue for them. It's not going to be an issue.
It's not going to be an issue, right?
Yeah. I was so enthralled in what you're saying.
Oh.
I let it go. It's okay. It'll come. Oh, this is what it is. I did this. I was born in February. So I did this exercise lately. I had my daughter when I was 40. And I want to live, if possible, to at least 97. So that she will be my age when I pass. Because she's fine now. She could live without me now. She's that independent. Mm-hmm. But, if I get her to 57, then I'm going to feel good about that. But then I looked and I realized that if I said 17 was the beginning of my adulthood, I've had 40 years of my first adulthood. And I really wrote it down. What do I want to be capable of at 97? Mm-hmm. I want to do what I want when I want to. Yeah. I want to travel if I want to. I still want to have my driver's license. I want to still be going to the gym, blah, 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 right? All the things. But then if I want that, then I have to pay attention to menopause today so that I don't lose my bones, my muscles, my brain, my heart. You have to pay attention so that you can have another adulthood.
Okay, so my most motivated patients are the ones who are looking at mothers and aunts and their generation above them and saying, hey, that's scary to me. Yeah. I don't want the chronic disease. Mm-hmm. I don't want to be plagued with arthritis or not being able to sleep or function or play with grandchildren or whatever their goals are. Mm-hmm. Like, they're not coming in to be skinny and look cute in a bikini. That would be nice, but, they are highly motivated as to the quality of life that they want. Yeah. And they see what the world offered their parents and what that's turned into, and what the lack of knowledge and education, filtered down. They're like, hey, help me. Help me, because I know I need to start now.
I see the future in my
I see the future, and like, how do I change this course correction? I was like, okay, perfect, let's go.
That's
you know?
perfect. Yeah. So, thank you.
You're welcome. Awesome.